Hi everyone, today we are going to learn about health problems in India. I am Dr. Beulah Dallas, HOD of Community Health Nursing Department, Tripura College of Nursing. The large populations with diverse socio-economical conditions, emerging and re-emerging diseases, increasing burden of chronic diseases, urban-rural health disparities. These are the main reasons the health problems are increasing in India. India has over 1.4 billion people with varied healthcare access. Both infectious diseases and lifestyle diseases are coexisting in India. Public health infrastructure faces major challenges in addressing these problems in public. India faces a dual burden of communicable disease and the non-communicable diseases. Due to rapid urbanization, lifestyle changes, and the population growth have influenced in this health trends in India. India is experiencing an epidemiological transition right now. Non-communicable disease now account for the majority of premature death in India. Communicable disease also still present, but the major growth is happening in the non-communicable diseases. Also, environmental and lifestyle risk factors also is taking important role in increasing the health burden of India. Let's see the categories of health problems. We can categorize into 5 main categories. One is communicable diseases, non-communicable diseases, nutritional disorders, maternal and child health problems, environment, and the lifestyle diseases. These categories reflect major public concerns across the country. Let's see about the non-communicable diseases. Non-communicable diseases are responsible for the majority of premature death among the adult, even in the school-age children in India due to lifestyle changes. Some of the non-communicable burdens are diabetes, hypertension, cardiovascular diseases, cancer, and the chronic respiratory diseases. Diabetes prevalence in India, about 11.4% of the adults they were diagnosed with diabetes. This diabetes has become one of the largest health concerns. Urban populations show higher prevalence of diabetes nowadays due to lifestyle changes. Over 101 million people living with diabetes, rapid increasing noted in last decades. About hypertension, it is often goes undiagnosed and untreated. Lifestyle changes and stress contribute to the rising prevalence. Around 35.5% of adults suffering from hypertension. About 315 million people already affected with the hypertension and its complications. Major risk factor for heart disease and stroke due to this undiagnosed, untreated hypertension. And the next major burden is obesity and overweight. General obesity prevalence is 28.6%. Abdominal obesity is 39.5%. But this prevalence is increasing among the children as well as adolescents also. This urbanization and sedentary lifestyles are the major cause of increasing the prevalence of obesity among these children, adolescent, and the adult in India. Due to increasing the hypertension and diabetic prevalence, the next problem is cardiovascular diseases. Leading causes of death in India due to this CVD includes heart attack and strokes associated with diabetes, obesity, and the hypertension. These lifestyle factors such as smoking, unhealthy diet, and the lack of exercise increasing the risk of this cardiovascular disease. Next, cancer. Common cancer in India are breast cancer, oral cancer, cervical cancer, and the lung cancer. Tobacco use is a major risk factor for oral and the lung cancers. Chronic respiratory diseases are asthma, chronic obstructive pulmonary diseases, that is COPD, air pollution related illnesses. Air pollution and smoking significantly contribute to respiratory diseases also. Communicable disease in India. It's a next major burden. Some of the main communicable diseases are tuberculosis, malaria, dengue. These are the vector-borne diseases. HIV and hepatitis. These are the infectious diseases remain major public health challenges in developing region. India has the highest TB burden globally, accounts for about 25% of global TB cases. This TB remains a major health challenge. Malaria and the dengue, these are the vector-borne diseases and seasonal diseases. And mosquito-borne diseases, it's remained common during the seasonal outbreaks, that is in rainy season. It is linked to sanitation and the climate conditions. This vector control and awareness programs are essential to follow or to control and eradicate this vector-borne diseases. Nutritional problems, that is malnutrition, micronutrient and deficiencies, iron deficiency, anemia, vitamin deficiencies. This malnutrition affects children and women in many rural areas, especially women during the pregnancy and lactating period, adolescents also, and the school-going children. So most of them affecting with malnutrition, iron deficiency, anemia, and the vitamin deficiencies. Childhood malnutrition problems. Due to this malnutrition, the stunting of the growth, it is affecting, muscle wasting, underweight. This poor diet and poverty can contribute to childhood malnutrition. The people are not getting adequate protein, adequate energy. That's the reason that's malnutrition like kwashiorkor and marasmus is developing among the Next, the problem is maternal health issues. Here the maternal mortality, pregnancy complications, limited healthcare access in rural areas. These are the main problems during the antenatal and the postnatal or during the labor it is happening. Government initiatives aim to improve the maternal health during this antenatal, internatal and the postnatal. And the childhood problems are infant mortality, low birth weight, childhood infections. Vaccination programs have helped reduce child mortality. So we are encouraging to utilization of vaccination among the children up to 1 year at 80 to 100%. The utility we need to be reached soon. Mental health issues are depression, anxiety disorders, stress and suicide. These are the common mental issues nowadays more prevalent among the public, especially the adolescents. Even the children, they are affecting with this stress and they are committing suicide. So mental health awareness is increasing, but stigma still exists. The next problem is environment related problems. Here everything is related to pollutions, mainly air pollutions, water contamination, and all the poor sanitation. This environmental factors significantly influence the health outcomes. The risk factors for health problems are unhealthy diet, physical inactivity, tobacco and alcohol usage, and the pollutions. So these all we can say it in one word is lifestyle changes. Nowadays the children and the adult, everyone is likes to eat junk food, not a healthy diet. And the physical inactivity, people are wants to travel by bike or car. This physical activities nowadays is very less. And the usage of tobacco and alcohol, not only in the adult, even in the school age children, they are practicing these habits. And another thing is pollutions, all kind of pollutions, especially air pollutions. These all addressing these risk factors can reduce disease burden. Some of the government health programs are there to improve the health of the public. That is Ayushman Bharat, National Health Mission, TB elimination programs, and vaccination campaigns. These initiatives aims to improve healthcare access and disease control. Let me conclude this topic. India faces both infectious and lifestyle diseases. These non-communicable diseases are rapidly increasing among the public. Preventive healthcare and public health policies are crucial. Collaborative efforts between government, healthcare professionals, and communities are needed to improve health outcomes. and reducing the morbidity, mortality, which comes through this health problems among the people. Thank you for your patient listening.